Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. Okay, first up today, today is April 13th, and it is the first Monday after we have the long weekend after Easter. So first message today is going to be from Dr. Tam and the federal health officials.
Okay, good afternoon, everyone. So today we will first hear from Dr. Tam and Dr. New, and then we will turn to Minister Bibo and Minister Schultz. Dr. Tam?
Good afternoon and bonjour à toutes et à tous. I'll just begin with our usual update on the number of COVID-19 cases in Canada. There are now 24,804 cases, including 734 deaths. I've noted previously that a significant proportion of these deaths are linked to outbreaks in long-term care facilities. Sadly, because COVID-19 can have a prolonged course, these deaths will continue to increase even as the epidemic growth rate slows down. For the lab testing, we've completed tests for over 428,000 people, with now over 5.7% confirmed positive, as Canada continues to improve testing to track where the disease is spreading. To save lives, families, communities, and businesses across Canada have shifted their behaviors to help break the chains of transmission of COVID-19. Though this challenge is nowhere near over, and we will have to work just as hard to get all the way down to a new normal when we reach low levels of transmission. How soon we get there and what that new normal will look like will depend on our actions right now. We know that physical distancing works to reduce the number of people who get infected, and once low enough, the epidemic will run out of fuel. One thing is certain: if we want a best case scenario, we need to give it our best efforts. We cannot prevent every death, but we must prevent every death we can. We need to protect our seniors. So stay home and save lives, and let's give our best effort to plank the curve. Then crush it. Thank you.
Bonjour. On commence tout d'abord par faire le point sur le nombre de cas de COVID-19 au Canada. On compte aujourd'hui 24 804 cas de COVID-19 au pays, dont 734 décès. On a constaté auparavant qu'un pourcentage important de ces décès est lié aux éclosions dans les installations de soins de longue durée de plusieurs provinces. Malheureusement, puisque le cours de la COVID-19 peut être de longue durée, le nombre de ces décès continuera à augmenter même si le taux de croissance de l'épidémie ralentit. Nous avons effectué des tests de dépistage sur plus de 428 000 personnes, dont plus de 5% ont été déclarés positifs à la COVID-19. Le Canada continue d'améliorer les tests pour mieux suivre la propagation de la maladie. Partout au Canada, des familles, des collectivités et des entreprises ont changé leurs habitudes pour briser les chaînes de transmission de la COVID-19. Nous resterons aux prises avec cette pandémie pendant un certain temps. Mais lorsque la transmission aura ralenti, nous ne pourrons pas baisser les bras et devrons nous habituer à une nouvelle normalité. On ne sait pas combien de temps nous prendrons pour y arriver, ni de quoi sera faite la nouvelle réalité, mais nous savons que l'avenir dépend des choix que nous faisons aujourd'hui. Nous savons aussi que l'éloignement physique permet de réduire le nombre d'infections et que l'épidémie s'épuisera lorsque les infections auront considérablement diminué. Une chose est sûre, notre avenir est entre nos mains et nous devons tout faire pour mettre toutes les chances de notre côté. Nous ne pouvons prévenir chacun des décès, mais nous devons prévenir tous les décès que nous pouvons. Il faut absolument protéger nos aînés. Alors, restons chez nous pour sauver des vies et acharnons-nous à aplatir la courbe le plus rapidement possible. Je vous remercie.
Merci, Dr. New. On va maintenant entendre la ministre Bibeau.
Bonjour à tous. Alors aujourd'hui, je suis heureuse de vous annoncer 50 millions de dollars pour aider nos producteurs et nos productrices agricoles, ainsi que les transformateurs alimentaires, à mettre en place les mesures nécessaires au respect du protocole d'isolement obligatoire de 14 jours pour tous les travailleurs étrangers temporaires. I'm happy to announce $50 million to help farmers, food and seafood processing employers put in place the measures necessary to follow the mandatory 14-day isolation period required of all workers arriving from abroad. Let me tell you why and how our government is taking one more step to help our farmers and food processors continue their vital work of feeding the nation, while protecting the health and safety of Canadians. Les femmes et les hommes qui travaillent au sein de notre chaîne d'approvisionnement alimentaire font un travail essentiel pour s'assurer que nous ayons accès à des aliments de qualité, variés et à prix abordables. Avant la pandémie, le secteur faisait déjà face à une sérieuse pénurie de main-d'œuvre. Chaque année, malgré que le secteur agricole accueille plus ou moins 60 000 travailleurs étrangers, environ 15 000 postes demeuraient vacants. Et cette année, le nombre sera encore plus grand. Dans plusieurs régions au Canada, la production d'aliments frais, surtout de fruits et de légumes, dépend en grande partie de la contribution de travailleurs étrangers temporaires expérimentés, et ce, de la saison des semences ou des plantations jusqu'aux récoltes. Les usines de transformation de poissons, de fruits de mer, de viande comptent, elles aussi, sur un bon nombre de travailleurs étrangers pour remplir les tablettes de nos épiceries. The men and women who work in our food supply chain are essential to ensuring Canadians have access to a variety of high-quality food at a reasonable price. In many regions in the country, the production of food, particularly fresh fruits and vegetables, relies on the contribution of experienced temporary foreign workers, right from planting season to harvest. We count on them to fill our shelves. The same goes for fish, seafood, and meat processing plants. This is why we granted an exemption for temporary foreign workers, along with other foreigners with work and student visas from traveling to Canada. But like all foreign nationals arriving to Canada during the COVID-19 crisis, they must follow a strict mandatory 14-day isolation period. Évidemment, comme tous les Canadiens qui reviennent de l'étranger, ces travailleurs doivent se conformer à une période d'isolement obligatoire stricte de 14 jours. Pour avoir discuté avec plusieurs employeurs, je peux vous assurer qu'ils prennent cette obligation très au sérieux et qu'ils ont à cœur de protéger la santé de leur communauté et de leurs travailleurs. Inévitablement, cette période d'isolement payée mais non travaillée va engendrer des coûts additionnels importants pour les employeurs, notamment pour offrir des lieux de résidence qui permettent le respect des règles imposées par la santé publique. Pour aider les producteurs et les productrices agricoles, ainsi que les transformateurs alimentaires à assumer ces dépenses extraordinaires, le gouvernement fédéral leur accorde un montant forfaitaire de 1 500 $ par travailleur étranger temporaire. We recognize that meeting these isolation rules come with a cost for businesses. That is why today I'm pleased to announce that the new federal support provides employers with $1,500 per worker to help put in place the measures necessary to comply with the strict public health requirements. This exceptional program will be available as long as the Quarantine Act is enforced and the isolation protocol has to be followed. Government authorities will follow up regularly, and employers or workers who do not comply will face severe sanctions and fines. At the same time, there continues to be thousands of jobs available in our food sector. Cet investissement de 50 millions de dollars s'ajoute aux gestes que nous avons posés pour assurer la sécurité alimentaire au pays. 100 millions de dollars pour améliorer l'accès à des aliments sains pour les Canadiens les plus vulnérables, une possibilité d'obtenir un prêt de 40 000 dollars sans intérêt avec la possibilité de 10 000 dollars et que 10 000 dollars soient non remboursables, extending loan deadlines under the Advanced Payment Program to help farmers manage cash flow, allowing all businesses to defer income taxes, GST, and customs duties, and giving $5 billion in additional lending capacity to Farm Credit Canada to help producers, agribusinesses, and food processors remain financially strong during this difficult time. I'm very proud of the strong and resilient food system we have in Canada. Step by step, we are giving our farmers and food processors the tools they need to continue their vital work. We will be there to support them throughout this difficult period. En terminant, je veux remercier encore une fois les producteurs et les productrices agricoles, ceux qui travaillent dans les usines de transformation alimentaire, les camionneurs, les inspecteurs, les épiciers, les bénévoles dans les banques alimentaires et tous ceux et celles qui contribuent à nous offrir des aliments de qualité, diversifiés et abordables. Merci.
Thank you, Minister. We will now hear from Minister Schultz.
Good afternoon, Salud, and thank you very much for joining us today. This pandemic has presented everyone with challenges. However, the most critical is slowing the spread and saving lives. As we know, this is most important for seniors and those with pre-existing medical conditions, as they are at the greatest risk of severe health complications due to COVID-19. Unfortunately, we have seen many long-term care homes in Canada experiencing outbreaks of COVID-19, with some facilities reporting multiple deaths. This is heartbreaking. Residents of long-term care homes are vulnerable to infections due to their communal living spaces, shared health care providers, exposure to external visitors, and transfers from other healthcare facilities. The Government of Canada has released evidence-informed guidelines to help residents, seniors, and healthcare workers in long-term care reduce the spread of the virus. Remain safe and healthy. Officials at the Public Health Agency of Canada developed these guidelines in close consultation with their provincial and territorial partners. La ligne directrice aidera les résidents et les travailleurs et demeurer en santé et en sécurité. Work builds on previous guidance in Canada and is informed by lessons learned in other countries, as well as interim guidance from other Canadian and international bodies. Long-term care homes are under the provincial and territorial jurisdiction. However, the guidance provides recommendations that complement provincial and territorial efforts to monitor, prevent, and control healthcare-associated infections. These guidelines may be adapted to other settings, such as retirement homes and residential homes for those with developmental disabilities. The key recommendations include measures such as restricting visitors and volunteers to only those deemed essential for basic medical or compassionate resident care, screenings before every staff shift or essential visitor entry and daily for residents, ensuring staff do not report to work with symptoms, and if they develop symptoms at work, are tested and excluded from work, requiring staff, essential volunteers, and visitors wear a mask during the duration of their shift or visit, providing training on infection control measures such as proper hand hygiene and use of personal protective equipment, routine additional cleaning, especially for high-touch, high-risk surfaces. Wherever possible, limiting work for employees to a single facility and limiting the number of locations in the facility in which employees work. And like all Canadians, practicing physical distancing to the greatest extent possible, including during mealtimes. That includes canceling non-essential outings. Many facilities have already implemented several of these measures, and for those, I applaud them for their vigilance and efforts to protect the most vulnerable among us. Providing consistent guidance for long-term care homes across the country will help save lives. And that's by protecting those seniors and those dedicated to caring for them. Assurer une guidance constante auprès des établissements de soins de longue durée. Aider et sauver des vies. However, it will take much more than these guidelines to keep our seniors and vulnerable Canadians safe. It would not be possible to keep them safe without individual Canadians practicing social distancing. We recognize that involves difficult decisions and personal sacrifices. It is essential that individuals practice social distancing to keep everyone safe. I want to acknowledge the role that Canadians all across the country are playing in flattening the curve and helping us all get through this. Most of all, I want to recognize all the caregivers and outstanding public health workers who are doing an exceptional job of providing essential service and who are working tirelessly in our communities in very difficult circumstances. We all need to do our part to help stop the spread of the virus among the residents of long-term care homes, as well as the workers who care for them. Together, we'll get through this. Thank you.
Next is a segment from the WHO, who will deliver a global message about COVID-19.
Thank you, Tariq. Good morning, good afternoon, and good evening. Some countries and communities have now endured several weeks of social and economic restrictions. Some countries are considering when they can lift these restrictions. Others are considering whether and when to introduce them. In both cases, these decisions must be based first and foremost on protecting human health and guided by what we know about the virus and how it behaves. Since the beginning, this has been an area of intense focus for WHO. As we have said many times before, this is a new virus and the first pandemic caused by a coronavirus. We are all learning all the time and adjusting our strategy based on the latest available evidence. We can only say what we know, and we can only act on what we know. Evidence from several countries is giving us a clearer picture about this virus, how it behaves, how to stop it, and how to treat it. We know that COVID-19 spreads fast, and we know that it's deadly, 10 times deadlier than the 2009 flu pandemic. We know that the virus can spread more easily in crowded environments like nursing homes. We know that early case finding, testing, isolating, caring for every case, and tracing every contact is essential for stopping transmission. We know that in some countries, cases are doubling every 3 to 4 days. However, while COVID-19 accelerates very fast, it decelerates much more slowly. In other words, the way down is much slower than the way up. That means control measures must be lifted slowly and with control. It cannot happen all at once. Control measures can only be lifted if the right public health measures are in place, including significant capacity for contact tracing. But while some countries are considering how to ease restrictions, others are considering whether to introduce them, especially many low and middle-income countries in Africa, Asia, and Latin America. In countries with large, poor populations, the stay-at-home orders and other restrictions used in some high-income countries may not be practical. Many poor people, migrants and refugees are already living in overcrowded conditions with few resources and little access to health care. How do you survive a lockdown when you depend on your daily labor to eat? News reports from around the world describe how many people are in danger of being left without access to food. Meanwhile, schools have closed for an estimated 1.4 billion children. This has halted their education, opened some to increased risk of abuse, and deprived many children of their primary source of food. As I have said many times, physical distancing restrictions are only part of the equation, and there are many other basic public health measures that need to be put in place. We also call on all countries to ensure that where stay-at-home measures are used, they must not be at the expense of human rights. Each government must assess their situation while protecting all their citizens and especially the most vulnerable. To support countries in making these decisions, WHO will tomorrow be publishing its updated strategic advice. The new strategy summarizes what we have learned and charts the way forward. It includes 6 criteria for countries as they consider lifting restrictions. First, that transmission is controlled. Second, that health system capacities are in place to detect, test, isolate, and treat every case and trace every contact. Third, that outbreak risks are minimized in special settings like health facilities and nursing homes. Fourth, that preventive measures are in place in workplaces, schools, and other places where it's essential for people to go. Fifth, that importation risks can be managed. And sixth, that communities are fully educated, engaged, and empowered to adjust to the new norm. Every country should be implementing a comprehensive set of measures to slow down transmission and save lives, with the aim of reaching a steady state of low level or no transmission. Countries must balance between measures that address the mortality caused by COVID-19 and from other diseases due to overwhelmed health systems, as well as the social economic impacts. As the pandemic has spread, its public health and socio-economic impacts have been profound and have disproportionately affected the vulnerable. Many populations have already experienced a lack of access to routine, essential health services. Our global connectedness means the risk of reintroduction and resurgence of the disease will continue. Ultimately, the development and delivery of a safe and effective vaccine will be needed to fully interrupt transmission. Finally, I would like to thank the United Kingdom for its generous contribution of £200,000 to the global response to COVID-19. And I would appreciate also the Prime Minister for his leadership and generosity. We greatly appreciate this demonstration of global solidarity. In an editorial last week, development ministers from the UK, Denmark, Iceland, Finland, Germany, Norway, and Sweden, calling on all countries to join this common endeavor. They said that tackling this disease together is our only option. I couldn't agree more. The way forward is solidarity. The rule of the game is solidarity. Solidarity at the national level and solidarity at the global level. I thank you.
Thank you very much, Dr. Tedros, for these opening remarks. We will open the floor to questions. We will ask journalists to be short and ask only one question, so we try to get as many as possible. And we will start, if possible, with Jamil. And we just need a second to get our lines on. Jamil, can you hear us now?
Yes, can you hear me?
Yes, now it's okay. Jamil, please go ahead.
Thank you, sir. This is Jamil Shade from UOL, Brazil. Dr. Tedros, what is your position, and especially in this new strategy by WHO regarding chloroquine? what is the evaluation WHO has on this medicament? Is it supposed to be used? Is it not supposed to be used? Do you recommend? Do you not recommend? Where are we in this issue? Thank you so much.
Yeah, thank you. Thank you so much. Before I pass this to Mike, I would like to say a few words. First of all, correction, the generous support from the United Kingdom is £200 million. And I'm glad also that the Prime Minister has recovered and is back home. And we wish him well. And I would like to appreciate him and his government and the people of United Kingdom for their generosity. Thank you. Mike.
Thank you, Theresa. The question was regarding the chloroquine. Yes, indeed. Sorry about that. The issue with chloroquine is chloroquine and hydroxychloroquine are licensed medications all over the world for a large number of indications, and in many cases are life-saving. And many patients with very difficult and chronic conditions are managed and have good lives in taking that drug. The initial and some initial indications that the drug may have some use in the treatment of coronavirus, of infections, and specifically COVID-19. And in fact, those drugs have been introduced to WHO's collaborations on trials under the Solidarity trials and also under the Discovery trials and other trials all over the world. So the medical and research community are really taking the potential of hydrochloroquine seriously, and chloroquine seriously, and it's currently, as I said, involved in a number of different trials. Some countries have issued guidance to clinicians that allows a clinician, in the case treating a patient, to use hydrochloroquine or chloroquine in an off-label mechanism. That means they may, under the current licensing of the vaccine, choose to use that in the care of a patient with COVID-19. There is no empirical evidence, there is no evidence from randomized controlled trials that it works, and clinicians have also been cautioned to look out for side effects of the drug to ensure that, first, we do no harm. We eagerly await the outcome of the trials that are underway, and Maria may have more details on that.
Okay, as you just heard, that they're moving forward with the WHO is moving forward with possible treatments, and they're in human trials with it's actually a drug or medication that is used to treat malaria. And they may or may not be having any real results with it, but they're moving forward with trials to see what really does work. Okay, next up, DrBonnie Henry, and then after that we will have a group discussion between Kelly Reaburne, myself, and Paul Gilbert of the BC Disability Caucus, and before we close out for today. Okay, next up is Bonnie Henry.
Good afternoon. I'm Adrian Dix, BC Minister of Health. To my right is Dr. Bonnie Henry, the Provincial Health Officer for British Columbia. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nation. Tomorrow and Wednesday we'll be briefing at 3 o'clock here in Victoria. On Thursday we'll be issuing a statement at 3 o'clock, but there will also be a major briefing, including a technical briefing Friday morning with respect to modeling. That will be in the morning on Friday. The public briefing will be later, but there'll be a press technical briefing beforehand. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. Today's update covers the last 2 days here in British Columbia, so 2 time periods between April 11th and 12th, and then between April 12th to today. So we have sorry, I have to read my notes here. So between April 11th and 12th, we had 25 new people test positive for COVID-19 in BC. And then in the past 24 hours, we've had 20 new cases, bringing us to 45 new cases since our last briefing on Saturday. The total in British Columbia is now 1,490 people who've tested positive for COVID-19 in our province. That includes 650 in the Vancouver Coastal Health Region, 591 people in the Fraser Health Region, 87 people here on Vancouver Island, 136 in the Interior Health Region, and 26 in the Northern Health Region. We have no new long-term care facility outbreaks. That remains at 20, mostly 11 in Fraser Health and 9 in Vancouver Coastal Health. We have had a number of new cases in those long-term care facilities, bringing our total to 254 people associated with long-term care facilities who have tested positive, including 159 residents and 97 staff people. In addition, we have a number of community outbreaks, as you're aware of. Primarily in the interior, we have the outbreak related to temporary foreign workers and a nursery. There's been one additional positive case in that outbreak, bringing the number of people who have tested positive to 20. The ongoing quarantine and isolation of all of the people in that community, and the Interior Health is working very closely with the owners and the property owners to make sure everybody is cared for and that they're able to self-isolate or quarantine effectively. In addition, we've had, as you're aware, one case identified at the Okanagan Correctional Centre. That outbreak remains under observation. As we know, there is a 14-day incubation period, so there is ongoing testing and surveillance being done at the Okanagan Correctional Facility, but to date, only one person has tested positive, and there have been a number of negative tests in that outbreak response. The other large outbreak response that we are dealing with, we talked a little bit about on Saturday at the Mission Federal Correctional Institute in the Fraser Valley. The outbreak continues to grow at that facility. We now have 35 people in the facility who have tested positive, including 8 who are now in hospital in the Fraser Health area. So this is, of course, of great concern to us, and we've been working very closely with Fraser Health, with Correctional Services Canada, and with the BC CDC to support the ongoing outbreak investigation, as well as the infection prevention and control measures that are needed within that facility. And our priority, of course, is to protect all of those who are in the facility, but ensure that British Columbians are protected as well, and that our community is able to respond and support people who are working in the facility, as well as the inmates in the facility and our hospital system. We are working very hard to ensure that the transmission within that facility will be contained. Unfortunately, as we talked about on Saturday, there was quite a lot of transmission that happened before the outbreak was recognized, and we are now seeing people who were exposed over the previous 2 weeks developing symptoms. And there's ongoing testing and surveillance that continues in that facility. In terms of our cases here in BC, we have 137 people who are hospitalized, and of those, 58 are in critical care or ICU here in British Columbia. Unfortunately, in the last 2 days, we've also seen a number of deaths increase. We've had a total of 11 new deaths, to bring our total of people who have died from COVID-19 in BC to 69. The majority of those continue to be in long-term care, and our hearts go out to the families and the caregivers of the people who have passed away over the last few months, and the challenges that we know are facing the families across British Columbia. We have 905 people who have recovered fully from this disease in BC. One of the key things that we have implemented in British Columbia to ensure that we have ongoing protection of our communities and our families as we welcome our fellow British Columbians home from where they might be around the world is our requirement for approved self-isolation plans for all returning travelers. This came into effect on Friday, April 10th. And I'm really pleased with the initiative, and my thanks go out to the many people who are involved with supporting this. The success of this initiative is really to provide the necessary supports that enable our fellow British Columbians who are returning to self-isolate effectively, to make sure that they have what they need so that we can support them and they join us in making sure we're doing everything we can to stop transmission of this virus. So since April 10th, 1,701 people have returned from around the world to British Columbia. That includes either by vehicle or by air. And we have the support systems in place and have been fully activated. 13 travelers have required accommodation because they weren't able to immediately fulfill their self-isolation plan, and 207 people have been contacted to ensure that they have what they need in follow-up. So thank you to our many partners, the many public servants here in BC who stepped up to be part of this initiative, and our partners with the Quarantine Service and the Canadian Border Services Agency. This is an important ongoing initiative to ensure that we're doing everything we can to keep our communities and families safe here in BC. I also want to talk a little bit about personal protective equipment. As you know, this has been something we have been consumed with in the last few months to make sure that we have what we need. We continue to actively source and receive supplies of PPE for all of our healthcare workers, and we want to thank you particularly to our neighbours in Alberta for their additional supply that they provided to British Columbia over the last few days. That's fabulous. We have enough PPE to meet our current demand, but we are not out of the clear yet. Many of you have also made very generous donations, and we want to thank you for that. And but to remind people that the best way for you to donate or to offer services and products is through the Supply Hub that has been established, and you can go to Supply Hub. And that is an important thing for us because we have a team of people who are able to make sure that anything that is donated meets the specifications that we need, particularly the medical specifications. Even N95 respirators are not all created equal. They are made for many different things, and some of them that are used in industrial settings may not be appropriate for the medical setting. So through the Supply Hub, we can make sure that these are all tested and they meet the specific specifications that we need to be used in the healthcare system. But we want to thank everybody for their ongoing efforts and contributions in this area. Finally, around weekend travel, we have asked British Columbians to avoid non-essential travel, and we have received many questions about BC ferries and about other travel options. I think it's safe to say that we have been united in keeping our firewall strong across this province. And BC Ferries continues to report more than 80% decline on travelers on all of their routes. So that is something that reassures us. But I do want to say there are many reasons why people may need to travel. And essential travel is still required to keep our province going, to make sure that we have the food, the medications, the things that we need in all parts of the province. Goods and the people to deliver our services still need to move. Many students as well are now returning home as the semesters have ended for our universities, and that is an important thing for them. I also know many people live and work in more than one location, and that means at the start and the end of their week, they may need to be on the road. But I thank you all for doing what you can to limit your need for travel. And everybody whose efforts to stay home and stay safe and keep a safe distance from others over this weekend. So today actually marks our 50th public update since this crisis began. And it's a key part of how we are trying to keep you informed and make sure that you know everything that we are doing and that we all have the information that we need to take the actions to protect our families and our communities. And Minister Dix and I remain committed to maintaining these updates for as long as they are needed. It is so important for all of us to keep going with everything that we are doing now. It is holding us, it is holding our line, it is allowing us to deal with these issues in a way that is the best that we can do for our province. We'll keep going with our updates and with our 24/7 provincial response on this issue for as long as we need to do that. And I'm asking you as well to please keep on the line, hold that line, keep doing what you are doing. And especially for our youth and our young people and our children, remember, this is not forever, but it is for now. And what you're doing is making a difference. So thank you for doing your part with kindness and with care.
And now a comment session between Kelly Reaburne, Paul Gilbert, and myself on what has really been going on for our communities, people with disabilities, and the elderly, with how the government and how our communities are reacting to COVID-19. Kind of a different animal, though, in many respects. I was explaining this to somebody else about AIDS, and Kelly, we have all of our levels good on my end.
Okay, well, I'll start on my end as well in case anything goes wrong.
Okay, cool.
All right.
Because
I'll go.
Go ahead.
I'll go on and start if you like.
Yeah. Okay.
Okay, I'm going in 5, 4, 3, 2. Hello, everybody. Welcome to the Community Living podcast. Right now, we're in isolation situation. I'm at my place in Vancouver, in central Vancouver, not at downtown or anywhere else, but I'm over in central Vancouver. Paul is in Victoria right now, so you're in the Esquimalt, right?
Yes.
Yeah.
Beautiful downtown Esquimalt.
Yeah. Isolating at your home, and of course, Michael is close to the border near White Rock, down in that area. So, welcome to you both.
Hey,
thank you.
It's good to be here.
Yes.
Likewise.
So, I wanted to start off the topic on a situation that I came upon on the CBC News the other day on the disabilities with support workers. Now, I believe that was in Ontario or Quebec, and one of her sons had cerebral palsy, and so for some reason they had the COVID virus or whatever it is, and somehow the support workers were like, okay, we're not going to support this kind of, situation, and all of a sudden they just left. It was kind of a shameful situation that was out front. I don't know if it was in Ontario or Quebec, but it was somewhere in Eastern Canada that happened. Michael, Paul, do you have any on those thoughts?
Well, I could. If somebody actually, if you're caring for somebody with the virus, I mean, these are pretty. Probably, if it's likely that these support workers didn't have any PPE, so they couldn't protect themselves from dying.
Right.
So I can understand why they left, because they didn't have. I mean, the mother is actually interacting with their son all the time, but the support workers are strangers, and if they don't have personal protective equipment, they can't actually stop themselves from getting sick.
Right.
Yeah.
So I mean, that's one of the problems when the government is recognizing that seniors in seniors care need people with personal protective equipment to work with them.
Okay.
They're not talking about the fact that people who work with people with disabilities need the same thing. We need to stop transmitting the virus to people with disabilities or to seniors and protect ourselves from catching it from them.
Right.
So we need the full-scale face mask.
The whole situation, the whole night.
Yeah.
Yeah. Michael? Well, you come on that front.
Paul is absolutely correct on that one. That is what the ultimate issue is the lack of the PPEs. Personal protective equipment is extremely important, and you're asking someone to do their job and receive a death sentence at the same time. That's not exactly a good thing to ask, is it?
It's hard to negotiate that into a collective agreement.
Yes, exactly. So, I totally get where Adrian Dix is going with this, because he was actually asked by, I think it was a National Post reporter. He's like, well, we were able to find masks. This reporter was able to find masks very easily and quite readily over the internet, and could have it shipped to himself within a day. But
really, because I tried to order some last week, a few days ago, and I couldn't get anything.
Well, I'm not exactly sure what the source of
I guess maybe
this National Post
maybe the sources are better. No, or maybe in BC they're actually making sure they don't sell to anybody except the hospitals.
Well,
I don't know,
and that would be extremely understandable. But what Adrian Dix came back with was that they didn't meet the specifications to be distributed anyway. Because
so they weren't really protective.
Absolutely. And the thing of it is a mask that is truly going to protect that worker from catching the disease. One has to have a metal strip across the nose so it can be affixed to the nose properly. It also has to have it isn't just a face mask; it's an actual respirator, which means that you have to be able to breathe freely to and through from it. And at the same time, it has to have a filtration that will filter down to a certain micron level that will stop the virus. The virus itself has size, it has mass and everything, and that mask has to actually filter out those particles so that the person can't get sick. And if it doesn't meet the specifications of that, then it's useless anyway. The person's going to get sick no matter what.
So basically this reporter was wrong and they were trying to embarrass the government.
So they don't have them to distribute. They don't have this personal protective equipment to distribute to the hospitals. How are they supposed to filter it to a support worker?
Well, no, that's what's happening actually now. They apparently according to Dr. Bonnie, they have enough for the hospitals now currently, but they wouldn't if they weren't actually restricting supply. So the only healthcare system receives it. Mm-hmm. I mean, that's what retailers are doing. They're mass producing personal protective equipment, the government, and they're getting it from other countries, and they're doing all sorts of things. But they're also restricting supply, so it only goes to the healthcare system.
Yeah. Well,
I mean, that's what they have to do because these people are actually at risk.
Yeah.
All of them. But it should actually be going to people who work with people with disabilities, too, because they're at risk.
Right. And it should, and I absolutely agree it should. While here in BC, you mentioned Paul, you mentioned the nursing homes and everything. It's like the health officials here have done a wonderful job of protecting the workers within the homes and everything. Whereas other parts of the country, you talk about desertion. There's a Quebec nursing home where they found starved bodies of the elderly and others covered in feces and everything else because we're the workers.
Mm-hmm.
Yes.
So this is going to become a problem across the country.
Mm.
Yeah, only two workers stayed at work, and everybody else left.
Mm-hmm.
And,
so,
yeah, I think that the employer should have actually been responsible in trying to draw in more people, or told the government that they had a crisis. It shouldn't have been something that they left until they had dead people.
Right. Absolutely. You know, we're pretty lucky here in this country that we do have true government support to an extent. I think it could be broader, and I think that they could do a way better job with the homeless, the indigent, and people with disabilities. I really think they could do a better job with it, but at least like the country south of us, it's non-existent at all.
Yeah. No, the U.S. has a for-profit healthcare system, and a for-profit system that should actually be a public good is insane.
Mm-hmm. So,
but I mean, actually, that connects with other things that have been happening too. The Carly Qualtrough asked a bunch of people with disabilities to be on her national advisory group for looking at dealing with the coronavirus and people with disabilities, but. I wonder if she's actually. It makes me wonder if she's actually read the Convention on the Rights of People with Disabilities. Sure. We've had that now for about a year or under a year, but she there's a section in the Convention, an article in the Convention that the government is supposed to be responsible for making sure that people with disabilities are safe in disasters, and that's what they're finding with the healthcare system and seniors. Is the sort of things they need to have found in advance. Like that convention is there because governments are supposed to be planning what they do in a crisis like this, and they've refused to do that. They've not been doing that. And I've been telling the BC government and the federal government for 2 years now that they have to be they're looking at what they're going to do with people with disabilities in a crisis, and they just ignore it. It's irresponsible because we know that there's going to be a crisis. Inevitably, there will be a crisis. We knew that the government anticipated the pandemic years ago,
yes,
but nobody was doing anything about it. It's in anticipation. But they know that there's going to be a crisis. You have to plan for them. I mean, you can't actually wait until the crisis happens and put certain things in place because you haven't figured out what you need.
Mm-hmm.
It should take thought.
Yeah. Well, has anybody got their GST refund yet?
Yes.
You have. I have.
Yes, I can. Oh, really?
I don't know why, but for some reason, it was supposed. Normally it's on the 5th week of the month that they normally do from the provincial government. But for some reason, I've been phoning. For some reason, they've not been giving me the actual GST refund on their income increase, for that matter. So I'm waiting until the end of today or tomorrow to see if they made their promises for their 3 to 5 business days to accept the GST returned as well. So far I haven't heard anything on it yet, but I'm still keep on trying to wait on it, maybe until next week or so. Then I'll get concerned about it because obviously I have a feeling a lot of Canadian governments are now focusing, okay, we've already done with the disability benefits or whatever it is. Now it's time to do with the situation on unemployment, small businesses, and lower incomes to people that don't have a job, for that matter. What are your takes on that?
Well, my first... go ahead, Paul.
No. They do seem to go through a cycle of what their priorities are when a issue comes up, and I don't. It's I think you're right. They may. It feels like they've overlooked some of it.
Right.
Yeah.
But in the end, they'll probably say, okay, we had a lot of money for those other lower income people and small businesses, and they'll say that, and probably in the end. Bottom line is the government will say, okay, that's it, we don't have enough money right now, so we're going to have to come back to you, the taxpayers, to pay more, shop more, spend more situation. Am I right?
On the issue with especially the small businesses, we haven't. Me and my wife, so far we haven't found the program that we actually fit into. So we are somewhat operational, but our operations is just barely going to cover the rent. Which, don't get me wrong, I'm grateful there's people out there that aren't getting their rent covered. So we're grateful that at least we're getting our rent covered.
Yeah.
But the long and short of it is, if you are somewhat operational, then it's the limitations are definitely in place, and we're still waiting to see what we do actually qualify as far as bailout money for, just so we can live as people, you know. So,
in fairness to the government, and the guy, one of the things that I think it's good to know is that the government anticipates that some people will make a mistake and apply for things that they don't necessarily qualify for, and they'll get the money, and then the government will sort it out afterwards. But they're expecting the government's response to the idea of people cheating them is that Canadians don't tend to do that. Mm-hmm. And so people act in good faith and try and get money that they need. They're not going to jump up and down on them, but they'll be asking for it back when tax time comes, because that's when everybody reviews what money you've gotten and what money you haven't.
Yeah.
So it'll come up.
You're
probably safe if
you bring up a good issue, and it's something that we better warn everybody right off the bat. If they are receiving certain monies for bailout for their situation, that come tax time, they are going to have to claim that money, and they are going to have to pay back in taxes.
Absolutely. Yeah.
So
because the government has access to all that information, regardless of whether or not you don't have to tell them; they already have all the documents.
Mm-hmm. Yes,
true.
So,
all right.
They're pretty pervasive. I mean, they're all over the place. The government is ubiquitous.
Yeah.
But, I mean, that's the good thing. I mean, the healthcare system in Britain managed to save their PM this last week, and I mean that was pretty impressive that the POs left to the healthcare system there. Mm-hmm. A lot of people do owe their left to the healthcare system, and it's tragic what's happening in the U.S. because they have a for-profit healthcare system, and it's very hard for them to coordinate it to get things working the way it needs to work to to protect people.
Well, and the last I heard was from Donald Trump saying that he's saying he's control of the president. He's the president, and he's saying that he controls all of the major governors in the states. That's what he's totally saying right now. This is kind of coming down to a turmoil where all the Donald Trump saying is, I'm in control, and the government's all secondary. That's kind of a bit of a disgraceful thing.
Yes, he's a bit insane. In a bad way.
Yeah, he's definitely doesn't seem to be running on all cylinders at all.
No.
And he was, I don't know how, I can't count the number of steps he was behind in this whole process of getting the U.S. Prepared for what is actually happening. And he hasn't really offered up any real support for people with disabilities, the elderly, or those people who actually have to work, like visible minorities, that where they're in a class of people where they actually have to go to work. And then he has the Surgeon General of the U.S. Issue a statement to people of color down there that they should refrain from alcohol and tobacco products because that's probably what's causing them to be infected on such a high rate, when the truth of the matter is that because of lack of government support, subsidies, and bailout monies to the people who really need to stop working and to stay at home, are actually out there working.
Yeah.
So
yeah, and they I mean, one of the things about the racial differences in the U.S. is that people of color end up getting in employment in circumstances that they're seriously disadvantaged in because of racism, and that's always been the case down there.
Yeah,
even the new and so no, they're put in vulnerable circumstances because of racism, and it's something that they really need to address down there. But I mean, we have it to some extent in Canada also. I mean, I feel that not necessarily everywhere, but certainly with average Indigenous populations, they're put at a disadvantage.
Yeah, the Indigenous populations up here have been asking for help from like the military and everything else with conditions that would help them avoid infection, and the military is being slow to react. They're still assessing the situations one by one for each of the areas to see if help is needed or what kind of help should be offered up. So
and they still. At the same time, the government hasn't complied with with human rights. The court's fighting for human rights for healthcare. They're supposed to be spending far more on healthcare in the Indigenous communities, but they've not done it yet, despite the fact that the courts have found them in violation of the human rights of Indigenous people.
Yeah,
it's kind of appalling.
Yeah, according to UN declarations, Canada falls very, very short of their responsibilities to Indigenous populations. So, and we could go reach out on a limb here and say that is also racism.
Yeah, it is. It's tragic because. I mean, when you're even if they weren't Indigenous people in these isolated communities that don't have enough resources, they'd be in the same circumstance. It wouldn't matter who was put in those positions, but they're in isolated communities that don't have resources, and the government's been giving them a third less money than regular Canadians in the cities receive, than other Canadians in the cities receive. So if you starve a community for decades of resources, then they're going to have problems.
Right. Absolutely. Paul, you're 100% correct on that one. And then when you do finally give them the resources that you would have given the normal population, who's used to having a level of resources, when you finally do bring resources in, of course they disappear within seconds because they have a hoarding mindset and this mindset of, hey, I don't know when it's going to happen again, so I better grab mine, and then they wonder why you see situations of violence and things like that occur, and it's because they've starved the population to the point it's like they're fighting rats. So.
Okay, I've got something here on includeme.ca on creating accessible for Canada. The report on it on March 24th saying the COVID-19 and disability recommends to Canadian government from disability-related organizations in Canada, and saying it is imperative that the government of Canada urgently address the unique vulnerabilities of people with disabilities and their families during the COVID-19 crisis. People with disability represent 22% of the Canadian population. Many are at extreme and require additional support to ensure their health and safety at this time. Some people with disabilities are vulnerable to COVID-19 because of the nature of their disability and related health challenges. Many others are at risk because of the measures put in place in response to COVID-19, which requires more people with disabilities and their families to distance themselves from their communities and support systems to invest funds upfront for supplies needed to maintain well-being during the extended period of isolation. You can go online to www.include-me.ca for more details on the information, but this information is pretty interesting. Do you have any thoughts on those comments?
Yes, I once again, I think that the government has been irresponsible in not planning for disasters for people with disabilities. I mean, everything. They signed a convention that said that they would, and then they haven't, and pretending that the convention doesn't exist, like Carla's done when she's asked a whole bunch of people with disabilities to come together and discuss what their needs are, and note who gets included. Once again, it's the charities that are under her thumb. I mean, charities cannot advocate. They're not going to be aggressive in asking for things because they would lose their funding. They're not allowed to be political. They're not allowed to advocate, and so those are the people that they include. People who actually will keep their mouths shut. And don't necessarily I mean, when you get an executive director of an organization, how much do they know? I mean, when you spend all your time doing accounting for years and years, accounting and promoting your organization and trying to get more money, do you actually have any awareness of what's happening with the disabled community?
Yeah, that's a good question. That's a good question on that.
And a very valid question, because how many... When you look at some of the really big organizations, where they are 95% administration and only 5% on the ground, the money is distributed 95% to administration and only 5% goes to the ground. Well, where does that leave the actual people who actually need the help? Where does that leave them? You know?
Yes.
So.
Yes, I remember. I can't remember the woman that actually resigned from the Liberal Party and ran independently. The former Justice Minister. Anyway,
Jody Wilson-Raybould.
Yes. Her father was observing, talking about what happens with what's been happening with the Indigenous population for years and years and years. Is the government pretends they're actually helping you by giving money to charities that support you. Well, I mean, that's not actually helping. That's funding, doing a sleight of hand where it looks like, to the public, it looks like they're helping, but the charities don't necessarily, the charities address what the government wants them to address and not necessarily the needs that exist.
Yeah.
They can't, they support the status quo.
Right.
Not necessarily the needs that really actually exist.
Yeah. And of course the charities that actually do 95% on the ground kind of work and only have maybe say 5% of it going to administration. Well, they're too busy working on the streets, helping people to be able to take the administrative time to actually apply for more grants and everything. And by the time they do, a lot of those grants are mostly used up by the ones who have large administration staff.
Yes. Yes, and those are the ones the government the ones the government's been funding that they use to pretend they're talking to the disabled, are the same ones they've been doing that with for decades. It's not been, they've not actually, it's like the consultations they held for the CRPD, it included very few people because they just included the people they always talk to.
Right.
True.
Yeah,
echo chamber sort of done.
It comes down to the conversation has to change.
Yes.
We need to
it has to be driven by.
Go ahead.
It has to be driven by including people with disabilities in the conversation, not just people who the government pays.
I knew you were about to say the same thing I was going to say. Is like that's who needs to drive the conversation, the people who really do need it, and we're not seeing that at this time. We're seeing it by some administrator in some glass office.
Yeah, no, it's just disappointing because we know that there's all sorts of issues that people with disabilities need to have addressed that are being ignored by the government or not properly funded by the government, that these charities aren't going to talk about.
Mm-hmm.
They're not going to push.
And
they can't.
Of course, like you said, they do push for these needs. Well, the funding will get cut off.
Yeah. Yeah, they wouldn't survive. The person in that job at least would be sacrificed by the organization to keep their money.
Mm-hmm. Yeah.
Yeah. So things like the amount of violence people with disabilities experience in Canada, which is staggering. It's 2 to 3 times the level of non-disabled people, and there's been no real work in it. There's been a tiny bit of work on it, really tiny, but not really what is needed. Like what they have to do is make shelters, violence prevention shelters, accessible to people with disabilities. That would mean giving.
Well, Paul, I'm going to stab at it like this, though. Paul, is like, if you can't walk out the door, how are you going to get support for somebody for domestic violence?
Exactly.
You're trapped.
You're all trapped there.
Mm-hmm.
Exactly. Very truly, that's one of the big issues that they have to. That the services have to be designed for people with disabilities, and we end up having our violence is more intense and lasts longer because of that issue. We can't walk out the door. The person who's abusing you is actually your carer.
Right. Yeah. How do you defend against that one? Is like, well, is if you take the I'm going to pardon the graphic of this, but if I take the punch, maybe they'll feed me today.
Yeah.
If I don't take the punch, they're going to starve me anyway. So, what do I want? The punch or the food? That's one hell of a choice, isn't it? Right? And that's what you're looking at when you are actually, if your abuser and you're trapped with your abuser in that situation, it's a hostage situation, and there's tons of studies on the hostage situations and what the psychology of that actually looks like. So I wonder if the domestic violence numbers against people with disabilities is actually underreported by an extreme.
I suspect that's actually the case, because the numbers really skyrocket the more vulnerable somebody is. Like, it goes up to 11% if you actually are nonverbal.
Right.
11 times the rate that non-disabled people receive violence.
So
the more vulnerable you are, the more serious it becomes. And so if you're, that's just really, really serious. That's one of the reasons why the numbers for violence you get on the Lower Mainland and they skyrocket. Like up north of Vancouver, you get a lot more violence. People experience a lot more violence than they do in Vancouver because they can't escape it when you get to smaller communities.
Mm-hmm. Mm-hmm.
So you're tuning to the Community Living Podcast. I'm Kelly Reaburne. Across from me is Paul Clogs and Michael Rubin Clogs. No, Michael Rubin Clogs. Sorry. Paul
Gilbert.
Gilbert. Sorry. Thank you. Sorry, guys. It's been a long day. Well, sort of a long day, but I'm not tired, but I'm just not thinking very well. But anyways, what do you think of the Dr. Bonnie's message today? Bonnie Henry.
I think the part I really focused on was the question around because I live near the beach, was she was asked why they aren't just ordering all the beaches closed, and I liked her answer was that she doesn't want to order the beaches closed. She wants people to do the right thing, and the right thing in this case is to stay indoors and not populate the streets. And I think that on some level, a lot of people are doing what is necessary to help curb this virus, And I think that some of what is actually fueling those people who aren't doing things is I've received a email from somebody wanting me to promote their message, and their message was simple as this: is that the government needs to hide away all those people who are vulnerable with disabilities and aging, and allow the rest of the population to live normally, so that we achieve the true spike of the pandemic. And the problem with this is, and DrBonnie Henry has said this, and Adrian Dix has also said this, is if we allow that spike to happen, what happens is it overruns the healthcare system, and many more people will actually die. So, and I wonder how many people are actually receiving these messages that are misinformation and aren't really based in sound science. As DrBonnie Henry, her message is based in sound science. We can even go as far as to say that she wrote the book as far as sound science is concerned in protecting people from epidemics. And I don't know how we stop these other messages from hitting people's ears, other than saying on right here, right now, that, hey, these messages are out there. Please ignore them, and please listen to what DrBonnie Henry and Adrian Dix are telling us, as well as Dr. Tam, and follow the example of our Prime Minister. He's staying isolated. So, what do you think, Paul? Go ahead.
I agree. I mean, there's a serious problem with misinformation getting out there. I was watching this thing on the internet the other day, and this guy, they were interviewing somebody who was claiming that things aren't they don't necessarily have to do any of these things, and things aren't as bad. But he was saying he needed to get data. Well, his argument wasn't based on evidence, and so he was waiting for evidence to back up his argument. It's a little irresponsible to make arguments in public and promote them when you have no evidence for them to actually be valid. Sure. The science is clear. The only country that actually is going the opposite direction and not doing anything about locking the society down somewhat so people are safe is Sweden, and their healthcare system is about to be overwhelmed because they only have 500 beds in ICU beds.
Yeah, I heard something about that.
Mm-hmm.
And they had 500 people that were infected just now, so that their healthcare system is going to collapse.
Yeah, and we saw what happens when the healthcare system collapses with Italy.
Yeah.
Mm-hmm. Yeah.
Well, I'm getting on to the point where you hear a lot of the stuff that you hear it on DrBonnie. What about the people that don't have any kind of communications, like TV, radio, those kind of stuff? And they say, "Oh, I just only heard it from a friend who just mentioned about it, but don't seem to care about this kind of a situation on the COVID." Paul?
Well, there are people. I mean, I actually had an argument with people a few years ago about the fact that some people just don't have internet access. Well, some people can't afford internet access, and the only internet access they have is the library, and the library's closed.
Yeah.
So some people are sort of out of the loop to some extent.
Mm-hmm.
It's inevitable because resources determine whether you have things or not, and lots of people in our society just don't have resources.
Mm-hmm.
No. And that's the point where a lot of public libraries give out their research on these kind of information, and they're not getting any type of information they need.
Yes, they close them down to keep people safe, but people aren't getting any information because they're closed.
Mm-hmm.
That's sort of a crisis.
Yeah.
I'm actually pretty impressed with the way our government's functioned on this, aside from sending all the PPE to China in February. I think they've done a good job in keeping the system moving forward. But I'm looking. I wish that everybody could have PPE like they're doing in. I think it's Taiwan. They're giving out PPE to all citizens because they've actually been working on this since December. They were ahead of everybody.
Yeah, did not know about that. Michael?
Yeah, I didn't know about that either. It kind of makes sense because when you look at the history of Canada versus relief, where do people reach out to, right? So, but at the same time, Justin Trudeau couldn't do what or shouldn't have done what Donald Trump did in blocking any shipments from going outside of the country and try to hoard everything and then not distribute it, of course. But
that's just irresponsible. I mean, we're not. Our economies can't be isolated from one another. It's impossible. I mean, to make their masks, they actually have to get the resources from Canada to do it. But they're saying, "Oh, Canada can't have it." It's just. I mean, this is the sort of thinking this guy's do. It does. It's just not thinking. He actually cut off money that was going to go to the Postal Service in the U.S. because he didn't want them to get money. And if the postal system collapses, what happens? I mean, people are dependent upon the Postal Service to actually receive food and things like that.
Yeah.
Or some sort of money checks or something coming into your mail or wherever that comes from.
Yeah.
Yeah. So I mean, we need an infrastructure to be able to, so people can adapt to these circumstances. But if Donald Trump is so oblivious about what really is necessary, he's willing to cut things off. I mean, it's just he's just irresponsible.
Yeah. Well, the history of the U.S. postal system leads all the way back to the revolution of that country, and I don't think I really don't think that Donald Trump has a true handle on what facts and everything are if it doesn't involve, of course, his corporation, right?
Mm-hmm. Yes.
So.
I'm not putting on records here. I'm just looking at the status of cases that is happening around the world. I know it looks as though the United States is number one on confirmed cases of COVID-19. But you look down to the bottom of the list here, and you see Yemen, 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 the town of the country of Yemen. They have only one case of the COVID and no deaths and no recoveries on that country.
That would probably because they can't test anybody, and their healthcare system has already collapsed because it already has.
Right.
It's Yemen has that was the biggest humanitarian crisis in the world because the U.S. and Saudi Arabia are bombing the hell out of them.
Yeah, I was going to say that. There it is, Paul. They have no resources. You mentioned earlier about paying for healthcare, and the World Health Organization and the International Monetary Fund has been trying to get funding and resources together so the countries like Yemen can because they can't afford to buy the damn test to test the people that have it. You know, it could be just some humanitarian doctor found this one isolated case.
Right.
You know?
Yeah. So I mean, I figure that the same sort of thing is probably happening in India, where they're not reporting people having the virus because nobody's testing people. But it's going to sweep through. I mean, the problem is, and what they're doing with their lockdown there is that people are going to starve to death. they're not allowed out of their homes and they don't have any food. So they're either going to starve to death or they're going to get the virus. And it's a major crisis in the third world. It's going to sweep into it, and after that, the virus will be available to everybody on an ongoing basis because we can't isolate ourselves from one another.
Yeah,
you just can't.
Well,
and the lower cases of the countries, the WHO should be thinking, well, if you have those kind of lower cases of the coronavirus, maybe you should do your own things and enjoy the rest of the non-essential work while the other countries are on lockdown and dealing with the COVID-19 virus.
Mm-hmm.
Right?
Well,
we definitely need everybody to lock down.
Yeah. I want to bring up Ecuador because there's mass dying in Ecuador, and people really aren't talking about it too much. That one particular town in Ecuador, that there's reports that the people are just taking the loved one, wrapping them in a sheet, and laying them on the streets in hopes that the government will come collect the bodies. Mm-hmm. Well, now we have COVID-19 running rampant through the streets of Ecuador. Now the bodies laying in the streets, decomposing, causes other bacteria and things to happen that is going to cause other mass dyings.
Yeah.
So,
well, Ecuador has about 7,529 cases right now over there.
Mm-hmm.
Close to about 355 deaths in that country. So
the problem with the data is that this is when they talk about New York being the epicenter of the crisis. Mm-hmm. New York has a healthcare system, and a lot of places people don't have anything.
Mm-hmm.
So you can't if you have to test somebody to know you have a pandemic, and if you can't test anybody, you don't have a pandemic.
Well,
it's data is only available if you actually have resources to have data.
Yeah.
Right.
The thing is the true numbers of how many people actually have passed away due to COVID-19 is going to appear as a number in the history books because of the autopsies, and that's where it is really going to be counted. But at that point, all those lives are lost, right?
True.
So.
Yeah, it's a shame.
Yeah.
Yeah, that's why people have to keep themselves safe, because it's really the only thing keeping you alive is the fact that you're not. If you're susceptible to the virus, as far as it being vulnerable, and it can actually cause serious injury and death. The government can't protect you unless you're protecting yourself. So we all have to be following what people like Bonnie Henry are telling us. Just keep ourselves safe, so keep other people safe.
Yeah.
Right.
One of the things that I thought was, I was talking to my sister the other day about the fact that people keep on approaching you when they're, despite the fact that there's a 6-foot limit. There space between people, are supposed to be a 6-foot space between people, so we can't transmit or pick up the virus. But people will end up standing right behind you or coming up right next to you, and then standing 6 feet apart. Because we're a lot of the problem with people doing that sort of thing is people basically operate off of habit mostly. Unless you have the habit of keeping yourself safe and keeping other people safe, you're not going to remember until you make a mistake, and that mistake can kill you.
Right.
True.
So it's people have to be more cognizant of what they're doing sometimes, because they'll walk up to you and stand right next to you or stand right behind you, and that if you're standing behind somebody who's infected, you could be dead because of that.
True.
Yeah.
All right.
Truly good point.
Well, I'm almost about to end the conversation soon, but I'm guessing you're still on Disability Caucus. How's that going along?
Oh, good. I'm a little slow this week as far as posting and participating because my computer crashed.
Oh, no.
Yes, had a virus, and then while I was trying to fix it, I ended up doing something that caused it to crash. And so but one of the things that's sort of nice about living in the real world is you can call a relative, have them buy something for you, and you send them the money. So I bought a computer online, and it's supposed to be delivered sometime this week.
Okay, so one of your postings on Facebook today is on influence of campers and trailers in the frustrates of residents of BC. Can you tell me more about that, Paul?
I would if I could have read it, but I didn't post it. One of our other participants posted it, or one of our other moderators.
Okay.
I haven't seen the page today.
Oh, okay.
I can't because I don't have a computer.
Oh, fair enough. Okay, that's one of the headlines. I thought you might have more information on that.
I would, but I don't have a computer at the moment, so I can't actually post things. I usually post things every day, but other people have post things every day too. So we have a number of people active to keep things going, but I'm not one of them at the moment.
Oh, okay, all right. Well, thank you, Paul. I appreciate the time of conference with you as well. And everything's all right in Victoria, am I right?
Oh, yes. It looks all right. People seem to be keeping their distances from one another, but everything seems awfully quiet. It's a very strange to live in a pandemic, and your streets are empty, your parks are empty.
Yeah.
It really feels like the old movies about being the last man on Earth.
Yeah. It feels the same way if you're going along Stanley Park. It's like, my mother and I last week went around the park before the government says, okay, we're closing the park now. That's the kind of thing. It's like, we've done the drive. Now it's everybody's doing their bike and everything on the roads these days.
Yeah.
So. Anyways, stay safe, Paul. And look forward to seeing you again. Michael, how's everything out how's White Rock over there? Well, how's your home?
Well, streets are pretty well empty. I talked to my favorite Cobbs because she has her one location open here in South Surrey, but the one in White Rock in the Semiahmoo Mall, she said that the mall is flat dead, and that the business is really taking a nosedive. So it's telling me that, of course, the Semiahmoo Mall's dead. Then I have driven along Marine Drive, which of course takes you right past the pier, and the city, while they haven't officially closed all the beaches, what they have done is made it pretty well impossible for you to visit the beach by closing all of the parking spots. You can't park anywhere. They've taped them off.
All the logs?
What's that?
Yeah, have they cleared up all the logs?
That I don't know about.
They've done it on Spanish Banks and English Banks, apparently.
Yeah, that's over closer to Crescent Beach more than it is by the West Beach where I am.
Right.
They have park benches and things like that up closer here, and by way of just taping off putting police tape across all of the entrances into the parking lots, it's really slowed the traffic, and it's also slowed the traffic to the businesses down there also, because just a couple weeks ago, the restaurants and the shops were all full, and not so much anymore since they've done that.
Yeah.
So.
All right. Well, I don't know any word on the Spectrum Society group, but you can go online, www.spectrumsociety.org, all in one word, and check out what they're doing on how to be safe through COVID-19, all sorts of information there as well. So check them out, www.spectrumsociety.org. That's where I am living with one support worker and family upstairs. So they're doing fine. I'm doing fine. So I'm basically myself just keeping washing your hands and keeping safe distance, that sort of thing. So Thank you very much, Michael and Paul. I hope to see you both next week. Maybe we can talk about some other issues as well. So.
Okay. All right.
Yes, the world goes on.
All right.
All right.
Thank you, guys.
Bye for now.
Bye-bye.
And of course, thank you for listening to Depictions. For a lot more information on press conferences and things like that, please do look for us at depictions.media.